Hi everyone, this is us. We're going to be presenting on low-level laser therapy. This is Grace.
Morgan.
Carlos. And Juan?
Okay, so here we go. So a little bit of background of the low-level laser therapy. It first started about when 1916 when Albert Einstein introduced the concept of stimulated emission, making it possible for the theory to be further amplified. So that's where it kind of started with Albert Einstein. And then 1954, Arthur Schawlow and Charles Towns from Columbia University made the first stimulated emission device. They called it a maser. And in 1960, Theodore Maiman made the first laser using a ruby as the lasing medium. And further in that year, in 1960, Ali Javan invented the first gas laser from helium and neon. And then late 1960, early 1970s, Andre Mester began the first exploration in clinical applications of non-thermal effects of laser light and found the first that stimulate tissue caused healing and was the first initial testing on humans. And in 1980, further advancements in technology with different types of lasers. And 2002 was the first year that FDA approved clinical use of low intensity laser in the United States for research purposes. And further in the year, by June, the first laser device was cleared for the use of carpal tunnel syndrome.
All right, so what is low-level laser therapy? So the acronym for laser is light amplification by stimulated emission or radiation. So basically, it is the application of this laser light for therapeutic purposes using diodes of less than 500 millivolts. And we could use this for to modulate pain, decrease inflammation, and to enhance tissue repair. So what makes laser light unique? So laser light is monochromatic, coherent, and directional. So monochromatic means that all the photons in the light have a single wavelength. That is why they all have this, that's why it's a single color. Coherent, which means that all the photons of laser light travel in the same direction at the same time, as we can see on the picture on the bottom left. And directional means that the laser beam does not diverge or spread as the distance it travels increases, allowing us the ability to target a small area precisely, as you can compare it to any other form of light. Let's say a light bulbs, the light reflects and it spreads as the distance increases. Laser light, it stays nice and tight. So as you can see, all these properties combined make the laser light unique from any other forms of light.
So here we're going to be showing you the radiation spectrum, where low-level laser lies on the radiation spectrum of visibility. So you can see that kind of the picture to the right, the visible light that our eyes can see is visible light starts about between 400 going up to maybe about 7 or 800 nanometers. That's where that rainbow scale is. So that's why we kind of see laser as red, because the low level laser is usually between about 600 to roughly like maybe 1,000 nanometers. 1,000 nanometers is kind of more going closer to infrared light, and sometimes you'll see that in clinic being used. But you can see about 600 nanometers where it starts to change, turning red. Where if you see the image to the left, where the helium neon laser was about 632.8 nanometers, and that's the laser that was invented by Ali Javan during the 1960s. So that's where it kind of first started. And then more closer now, we kind of more use the gallium arsenide laser or the gallium aluminum arsenide laser, which the gallium aluminum arsenide was used during that article that we found, which is used for osteoarthritis. So you'll see that a lot, and that's roughly between 7 and 80 nanometers. 780 and 680 nanometers, and the gallium arsenide laser is about 904 nanometers. So that's kind of where it lies on the radiation spectrum.
All right, so there is different types of laser classification. So there is class 1, class 2, class 3A, 3B, and 4. The one that is used for low laser label therapy is a class 3. 3B, which has a power output of under 500 milliwatts. This is the one that's used for therapy. Just a couple of things that it is strong enough that it can cause permanent eye injury if it is seen directly. Also, the viewing of the diffuse beam is reflected on the skin, which means it's safe, but it can also cause minor skin burns with prolonged exposure. So, higher power means you can have a shorter treatment time, but you can also have a deeper penetration of depth into tissue.
So here you can see the different types of low-level laser therapy lights, which is used with a diode. In the image to the right, you can see the image how the light goes from kind of superficial to deeper, where the LED, the light emitting diode, is a little bit more superficial, and that LED is a more low intensity light that it's not coherent or monochromatic, so you can see that it kind of spreads a little bit more than the other ones. And the super luminous diode, the SLD, is monochromatic, but it's also non-coherent, so you can see that light kind of spreads a little bit more, so it doesn't go as deep as the LD, which that's the laser light diode, and that penetrates deeper because it's monochromatic, coherent, and directional. So it can reach to a more deeper cellular level.
So effects of laser light therapy: it promotes ATP production, promotes collagen production, it modulates inflammation, inhibits bacterial growth, promotes vasodilation, and alters nerve conductivity, velocity, and regeneration.
Okay, FDA approved indications include increase of localized circulation, relief of minor muscle and joint aches, pains and stiffness as well, relaxation of the muscles, muscle spasm relief, and relief of minor pain and stiffness associated with arthritis.
Research-based indications for LLT, these are all different indications, but ones that are directly affected by our research are myofascial trigger points, RA and OA, TMJ disorders, and also carpal tunnel syndrome.
Contraindications for low-level laser therapy include direct irradiation of the eyes, malignancy, radiotherapy within the last 4 to 6 months, over any hemorrhaging regions, and over the thyroid or any endocrine glands.
Precautions are low back or abdomen during pregnancy, epiphyseal plates in children, impaired sensation and mentation, photophobia or hypersensitivity to light, and pre-treatment with one or more photosensitizers.
All right, so application of this modality starts by cleaning the skin with an alcohol swab to make sure it's free of any debris or any dirt or anything like that. There is no medium used for this, for the delivery of LLT. Stationary techniques should be used, for example, using a towel under your popliteal fossa if you're applying it to your knee. Maintaining a firm direct contact with the skin is very important. Both the patient and the clinician must put on manufactured provided protective eyewear to prevent any harm to the retinas.
All right, so some adverse effects from the laser therapy include transient tingling, mild arrhythmia, skin rash, burning sensation, irradiation of the eyes, which could include retinal damage and burns. So when it comes to documenting, you would document which type of diode you would use. So whether it was the LD, LED, or the SLD, document the wavelength that was used, the power output, the area of the body that was treated, including the surface area that was treated, the energy density, which will be documented in joules per centimeter squared. And the duration is not listed because it was usually included within the parameters or in the preset set by the machine.
So these are our references.
Yeah.
So
If you want to go back and look at our article that we used, or if you want to go back and get informed with anything else, feel free to do so. Cool.
Okay.
Cool.
Good. Bye.